Can speech be restored after laryngectomy and tracheostomy? Imagine losing your voice and wondering if you can ever speak again. For many people who have had a total laryngectomy and tracheostomy, this is a common concern. The good news is that speech can often be restored through various methods. The most widely used and effective approach involves a device called a tracheoesophageal voice prosthesis. This tiny device creates a new way for air to produce sound. After a total laryngectomy, the vocal cords are removed, so natural voice production is no longer possible. But with a tracheoesophageal voice prosthesis, a small passage is surgically made between the windpipe and the food pipe. A one-way valve is inserted into this opening. When the person exhales and covers the stoma, or opening in the neck, air is pushed through the prosthesis into the esophagus. This causes the upper part of the esophagus to vibrate, creating sound. The person then shapes this sound into speech using their mouth and tongue. The voice produced is usually rough or hoarse but sounds more natural than other options. Speech-language pathologists play a key role in helping patients learn to use the prosthesis correctly. They teach how to care for the device, perform speech therapy, and improve voice clarity. Besides the tracheoesophageal method, there are other ways to regain speech. Esophageal speech involves swallowing air into the esophagus and then releasing it to make sound. This method does not require surgery but can be hard to learn and has a lower success rate. Another option is the electrolarynx, a handheld device that produces vibrations externally. The person places the device against their neck or cheek and articulates the vibrations into speech. This method is simple to use immediately after surgery but produces a mechanical-sounding voice. The choice of method depends on the person's health, motivation, and personal preferences. The tracheoesophageal voice prosthesis is generally preferred because it offers better voice quality and higher success rates. About 70 to 90% of patients using this method achieve functional speech. Speech therapy helps improve clarity and confidence, making social interactions easier. Restoring speech after a laryngectomy and tracheostomy is possible and often successful with the right approach and support. It allows individuals to communicate effectively and regain a sense of normalcy in their lives.